Hello, everybody, and welcome to the InTouch Health webinar series. This is Scott Young, and I'll be your host for today's webinar. Today, we're featuring InTouch Health's Rich Evans and Andre Grujovski as they introduce Solo by InTouch, our next-generation software platform. Andre is the VP Solutions and Product Marketing at InTouch Health. He has worked at InTouch since 2005 and has served in a variety of roles, including account management, product management, and marketing leadership. Andre received his BSc from the University of Michigan and his MBA from Pepperdine University. Rich is the VP Software Product Management at InTouch Health. Rich has worked at InTouch for 12 years and started his career at InTouch in operations. He has overseen many different products and platform systems within the product organization. Rich received his BA from UCSB and MA from Middlebury College. We'll begin the webinar shortly, but first, a few notices. You have all been auto-muted. If not, please make sure you mute yourself. At the bottom of your audience console are multiple application widgets you can use. If you have any technical difficulty, please click on the Help widget. It has a question mark icon and covers common technical issues. Please also ensure your media player volume is turned up. You can expand the slide area by clicking on the Maximize icon on the top right of the slide area, or by dragging the bottom right corner of the slide area. During the webinar, you'll be able to enter questions in the Q&A widget located on your audience console. Questions will be answered at the conclusion of the presentation, so please feel free to ask your questions at any point throughout the webinar. If a fuller answer is needed or you run out of time, questions will be answered later via email. This webinar will be recorded and should not exceed 60 minutes, including time for questions and answers. And now, I'd like to turn it over to our presenters.
Scott, thanks so much. This is Andre. I'm going to review the objectives for the call today. So what we want to do is, first we want to provide you an early look at Solo by InTouch. Then we're going to show how Solo can be used across the continuum of care for a host of different use cases. We're going to discuss how Solo was built based on our core competencies. And we're going to highlight how Solo creates a new level of interoperability for our customers' virtual care program. First, I want to reinforce that we're excited to give you an early look at Solo. Solo will be officially unveiled at our annual Telehealth Innovation Forum. The forum, for those of you who may not know, takes place every year here in beautiful Santa Barbara. For those of you who have not attended, the event is a showcase of InTouch customers who take the stage to highlight the key advancements they are making across all things telehealth. This year's lineup is sure to deliver another revolutionary event. Registrations for the event are already projected to outpace all previous years, and we'd love to have you join us again or make your first trip to the conference. You can find details on our website under Company and Forum if you're interested. And so before we jump right into Solo, it's important for us to paint the picture of where we've been and the groundwork we have laid. Over the past 2 years, our customers have rated us best in class for virtual care platforms. This distinction pushes us to ensure that we continue to bring quality products to the marketplace and not only meet but exceed our customers' expectations. We hope that the foundations we are laying will pave the way for you to continue to grow and expand your programs with InTouch.
Thank you, Andre. And we also wanted to highlight that InTouch will continue to be a managed service provider, and we've built a global infrastructure that supports our customers 24/7, 365, and ensuring that uptime, connection success, and technical support sets the bar in the marketplace. As we develop and deliver Solo, we're continuing to improve these services and take our customer service to the next level. And as we embark on that next phase of our journey, we will ensure that all the support that our customers have come to appreciate from InTouch is continued through the Solo journey.
Thanks, Rich. And so in order to show you where we are going, we need to tell you where we came from. And since 2003, InTouch has been building the best medical devices for telehealth in the marketplace. And the user's experience for connecting to those devices has been through what we call our provider access software, which you see on the left of the screen there. This software interface provides clinicians with a simple and intuitive experience and leverages the power of the InTouch operating system to ensure high quality, reliable, and secure connectivity. This combination of hardware and software has enabled leading virtual care applications in the areas like stroke, behavioral health, critical care, neonatology, and many other emergent and high acuity use cases that were based inside the four walls of the hospital. As we saw the virtual care marketplace grow and we saw our customers exploring new areas of virtualizing care, we continued to expand our capabilities. In early 2018, we acquired new web-based software technology that allows telehealth to go beyond the four walls of the hospital and directly to the consumer. This new software, which we call our Provider Access web app, leverages what we call virtual waiting rooms to allow the patient to enter the room using a web browser on their own device and the provider to enter in a similar fashion. This software solution has allowed our customers to go right into the patient's home and to offer direct-to-consumer and direct-to-patient programs to treat patients seeking care or being followed up with routinely. Adding on this technology has expanded our offering and started to open up even greater possibilities. And so now we knew we had two great offerings for our customers, but we also knew that they would become even more powerful if they were combined into one single experience. And so over the past year, we've been working to create a single unified virtual care platform that allows our customers to truly provide virtual care across the continuum. And now we're pleased to give you a look into Solo by InTouch. So let's take a look. We're going to play a short video for you that we hope highlights and demonstrates what Solo is starting to look like.
You're busy managing your patients, your staff, and your systems. InTouch Health has been busy too, busy working to make your life easier. Introducing Solo by InTouch, our next-generation software platform. Solo by InTouch includes interoperability, software modules, telehealth or consumer devices, and the industry's most reliable network to create virtual care solutions that meet your needs. Expand your capabilities with robust, patient-centric software and integrated technologies across healthcare's only unified platform. Now you have the freedom to capture new patients from your website, respond to an emergent consultation, or launch a scheduled visit from your EMR, all in one place. Because it's web-based, users experience the same interface across the platform for any use case, acuity level, and patient. Designed in a modular fashion to be easily configured, Solo by InTouch scales system-wide across the continuum of care to connect any patient to any provider. Fully integrated and interoperable between EHR systems and third-party applications. Users only need one username and password. This means easy navigation and seamless workflows. It's virtual care that's truly convenient. But don't take our word for it. Our solutions are trusted by some of the leading health systems because they are designed to provide virtual care as if your patient was in the room, so you can focus on the patient, not the technology. Solo by InTouch is the backbone of healthcare's only integrated virtual care platform. It serves as the foundation for 5 modular software applications on the industry's leading cloud-based network, giving you the tools you need to efficiently and securely.
So now that you've seen kind of a video that kind of gives you an overview of Solo, one thing that we wanted to highlight was this dashboard that you saw in the video. And the dashboard is really a entry point to kind of view all the capabilities and features of the Solo platform. You can see on the left dashboard there that you can see a queue, schedule, waiting rooms, care locations, smart notes documentation, imaging, messages, analytics. Really, because of the breadth of capabilities that we're building into the Solo platform, the place we wanted to start from a good user experience and a provider and patient experience is this dashboard that ties it all together. So when a user logs in, they have a clean and easy way to see what their work is, and their work is brought to them so that the provider can have a clean user experience and focus on that patient care.
And Rich, as our next generation software platform, Solo is built on top of our InTouch operating system and managed services that we've always provided. And now is at the heart of any clinical use case. So core to the Solo experience are the software modules that we'll describe shortly, and just as critical is that Solo acts as the conduit into our customers' health IT systems like EMRs, scheduling packs, secure messaging, paging systems, to name a few. So Rich is going to tell us a little bit more about those core features that Solo has to offer.
So as you could maybe see within the video, there's some key technology changes that we're starting to build into the Solo architecture and back-end systems. One thing that you may have noticed is we're starting to focus more heavily on browser-based applications and enabling our applications to be accessed through the web. That will not negate the need for a desktop application or mobile devices, but the goal of the system is to create the easy accessibility for all users, irrespective of what device they're coming in on. Another example is down in the bottom right-hand corner there, you see patient-centric architecture. As this platform begins to cover the broad spectrum of patient care and follow a patient across the care continuum, it was important that we add in a patient-centric architecture, and we'll talk a little bit more about that when we get to things like our Smart Notes application. A couple of the other back-end architecture components to this is enabling a single sign-in and federated authentication, or the ability for you to use your health system username and password to create easier accessibility for your providers. And then as we talk about some of these modules, you'll see we are aggregating all this data into a single stack, enabling better analytics, better data, better user interfaces, and a more consistent experience for those end users of our platform. So the first thing that we started with is, because of our reputation for reliability, scalability, but also security, is taking all that we've done in the past and applying it to the future. So as we build out Solo, one thing that became critical to our back-end development teams is to ensure that all of the security that's been designed into our systems up to this point continues on into the future as we broaden our capabilities. So for example, we will continue to do things like AES 256-bit encryption and try to stay in the lead in terms of encryption and security for data. We'll also continue, obviously, to maintain our HIPAA compliance. But some changes have to be made, for example, around role-based access, as we now have new user roles and new user types accessing the system through different types of devices. We've broadened that and expanded that, and we'll continue to make sure that our system is designed to be secure.
Thanks so much, Rich. So now what we're going to do is we're going to go deeper into Solo by showing you some examples of how Solo can work for you across the entire continuum of care as the patient makes their way through their journey. We like to break up the potential use cases into three core segments: consumer, emergent, and specialty. The consumer use cases that we like to think about are those that are typically low acuity and originate in a patient's home or even perhaps an outpatient facility. Emergent use cases are happening in a hospital or emergency department and require immediate access and response. The specialty use cases are happening in post-acute facilities or clinics and are typically affiliated with patient follow-up and ongoing treatment. The key point is that we recognize that these different settings and environments require different pieces of technology to support them effectively, and we bring them to you all through our single Solo platform. So let's take a look at our emergent use case, and here we're going to play a short video showing you how Solo can be leveraged to provide an immersive experience for treating a stroke patient.
Using Solo by InTouch, our next-generation software platform, stroke care and workflows become faster, more efficient, and unified. The InTouch stroke solution includes imaging, documentation, coordination, and analytics modules, delivered in a concise workflow on a single platform. For a suspected stroke, EMS radios in a pre-notification to the ED. The ED operator captures data in the Smart Notes module intake section to facilitate rapid triage. A stroke team is ready to respond 24/7, including a remote neurologist. The ED nurse station requests the hospital operator issue a code stroke. The code is issued from a single call activation system, which can be integrated with InTouch Coordinator, so the on-call remote provider is also pre-notified. The stroke team has prepared tools for managing stroke emergencies. The Smart Notes module adds a virtual stroke toolkit with stroke-specific order sets, guidelines, NIH stroke scale, and more. Upon triage and an initial assessment by the stroke team, Altiplays is mixed ahead of time. Upon CT acquisition, the user dashboard and coordinator alert the remote provider, who can rapidly begin interpretation of the brain imaging via the InTouch imaging module. As the patient-side stroke team gets results back from the point-of-care lab testing, They are able to simultaneously document via InTouch Smart Notes and enter data into the encounter record with the provider. Once the remote neurologist completes their imaging review, NIHSS, labs review, and understands patient history, they determine the patient is eligible for TPA, and rapid access to the treatment is possible. Via the bidirectional access to Smart Notes, Solo by InTouch helps facilitate a team-based approach to stroke care, creating reviewable audit trails and clinical narrative for each encounter for later review and process improvements. Following target stroke best practices, the stroke team, including remote neurologists, meets monthly. The team reviews the data and clinical audit trails for each location with the InTouch Analytics module. They review door-to-needle times, alteplase treatment rates, and other stroke performance measures to identify opportunities for improvement. With the InTouch stroke solution, patients benefit by having greater access to specialists. Stroke hospitals benefit by...
So if we take a deeper look at the components of that solution, you'll see from the video that our Smart Notes and imaging modules were key pieces that allowed for a robust end-to-end experience for our customers. So Rich, why don't you tell us a little bit more about Smart Notes and imaging?
Sure. Thanks, Andre. So I started with that dashboard because that is the entry point for which the provider can see all of their work kind of brought to them. And again, focusing on that user experience and optimization of the provider's time. That's where the provider would start. But what we're building new in Solo is a new Smart Notes module that's built into the same tech stack and the same UI, so it is a seamless experience to the end user provider. But it still provides that same clinical documentation capability that we've had in the past, except now, as I mentioned earlier, it's patient-centric, and it also has some new tools built in for different types of use cases and different tool sets that a provider might need for a virtual use case. Even though it is still a new Smart Notes module, it still has the same capabilities to bridge your EHR systems and function as a tool that sits across a virtual healthcare network where you have multiple EHR systems or other documentation tools, and you want that provider to have a single experience and a single tool. On the back end of it, we still have all the same capabilities to be able to do the distribution of data and send the notes to all your respective EHR systems. But at the end of the day, it is embedded into the provider experience. That also continues over into our imaging module. So for those that have experienced our imaging module, you know that it is set up specifically for virtual health, wherein you can pool from a remote provider can pool images to them, so they're not dependent on all these disparate IT departments. And when they need to see imaging, they can see imaging for a given patient in an emergent situation. The new imaging module is zero footprint, and on the server side is actually now available with a VMware, kind of oriented towards, again, trying to create a lighter footprint, a faster implementation, and a more scalable architecture for our modules.
Thanks, Rich. So let's take a moment and do a quick poll for our customers. We're really interested in understanding how many of you are currently using telemedicine to support any of these use cases. This really helps us when we think about where the core focuses are, what our customers are doing, where their interests lie, and particularly how we can think about Solo supporting those use cases as we continue to build them out into the future. So thanks so much for that, and we'll continue on with our next example. So here is the specialty segment use case. So again, we're going to play a short video showing you how Solo can be leveraged to provide coordinated care in a clinic setting.
Solo by InTouch, our next-generation software platform, makes it easy to see patients remotely in a clinic. Whether managing cardiology, neurology, orthopedic, or multi-specialty clinics, our flexible solution provides a broad range of customizable workflow options for users. The InTouch Coordinator software module makes it easy to schedule a patient using multiple options, including having the patient schedule themselves for a visit through the Select a Service page, having the medical assistant or staff schedule the patient prior to the visit, or integrating directly with the scheduling system. At the time of scheduling, a device care location can be pre-selected to avoid any scheduling conflicts that may arise. The check-in process is quick and easy with InTouch Intake. Patients can either be checked in by a receptionist or check themselves in through a patient station. At this point, additional patient information can be captured, such as demographic changes or a history of present illness. Now that the patient is ready for the visit, the medical assistant can assign the patient to the correct care location through the screen of the device. The patient status will now change to assigned. Vitals and other medical information can also be captured at this time. Once the patient is prepped and this phase is complete, the patient status will change to waiting, and a notification is sent to the remote provider. The provider receives the notification and can connect to the patient. The provider has full flexibility and can decide whether to first review vitals and patient history or connect directly to the patient. During the consultation, the remote provider can document and create a final progress note using the Smart Notes module. Once the interaction is complete, the provider can continue to access patient information and documentation, allowing for flexibility in clinical workflows. The patient can now be scheduled for a future or follow-up appointment and repeat the process. Leveraging the power.
So now if we take a deeper look at the core components of that solution, you'll see from the video that our coordinator module really helps to facilitate the interaction between device, patient, and provider. So Rich, why don't you tell us a little bit more about coordinator and how that helps and enables other functionalities like consult request capabilities?
So as you just saw, the InTouch coordinator notifies the remote provider when a patient is prepped and ready for the consult. Vitals and other pertinent information are transferred through the Smart Notes module to the provider, and the provider beams in directly to the patient only when they and the patient are ready. Coordinator really helps to facilitate and coordinate the clinical workflow. The idea of coordinator is in a virtual care scenario where the two participants, the provider and patient, aren't in the same place to make it easy and optimal for them to connect when necessary and when ready. So if you just saw that consult request in the context of coordinator, it was very oriented towards that scheduled specialty visit where a patient is going into a facility and maybe they don't necessarily have any emergent situation. But that being said, the same consult request capability that we just showed in the context of the specialty clinic could also be extended to other use cases, such as the emergent use case or any other type of use case wherein you need services like translators or other services that you would want to bring to the patient's bedside. Ultimately, that consult request capability queues that service and retrieves the specialty that you need at that patient's bedside.
Thanks, Rich. So we're going to take another quick moment, do another quick poll, and see how many of you are currently using telemedicine to support any of these existing use cases, like specialty follow-up, specialty readmission. You're looking at sort of reducing readmissions. Are you looking at doing referrals, behavioral health in clinics, other types of clinic-based or specialty-type solutions? Okay, thanks for that. So next, we're going to go into our third example, which is the consumer segment use case. Again, we're going to play a short video for you showing how Solo can be leveraged to reach consumers directly in their homes.
Offer your providers and patients a seamless experience with Solo by InTouch, our next-generation software platform. Consumers today have many options and search online for healthcare providers from their home computer, tablet, or phone. By linking directly to InTouch's web-based intake module from your website, patients can access your telehealth services on demand with just a click. This lets providers enhance their online presence and create a virtual front door into the clinic. InTouch automates patient check-in, seamlessly and efficiently routing the patient and their data to the appropriate provider. The patient intake experience can be customized with white labeling and custom-made medical questionnaires. Easily collect information from patients in any format. Once the patient completes the intake forms, the provider is notified that there is a patient ready to be seen. Providers can access their patients directly from a web browser or from a downloaded application on the provider's device. With Solo by InTouch, a provider can configure their view of appointments for the day and review patient medical history before connecting. Once connected into InTouch's superior audio-video experience, providers and patients have several tools available, including screen sharing and chat. Group calling allows you to request additional participants to join visits via email, text, or browser alerts. This lets providers receive second opinions or assistance for virtual consults. InTouch Smart Notes enables providers to select use case-specific templates and allows certain patient-generated fields from intake questionnaires to auto-populate in the note. Providers can document in real time within the same screen, enabling them to keep their eyes on the patient during the whole visit. InTouch can integrate bidirectionally to your EMR, virtually eliminating the need for manual double entry. Get patient-generated data and provider documentation in the format you want, where you want it. Program administrators can configure every feature of the patient check-in journey to meet your clinician's workflows and your organization's goals. For example, setting the operating hours. Enable both patients and providers to schedule virtual appointments using our next-generation software platform or through integrations with your EMR or calendaring tools. Choose to include insurance verification. Empower providers to deliver high-quality patient experiences.
So if we take a deeper look at the core components of that solution, you'll see from the video that our intake module is what really allows a patient to enter into that virtual care workstream. So Rich, why don't you tell us a little bit more about intake?
So the way intake was designed, and again, kind of orienting our development processes towards a better user experience, we've tried to optimize the patient intake process. So when a patient is outside of a facility acting on their own behalf and doing a lot of these steps, we want to make it very easy for them. So you saw a lot of things in the video in terms of asking very basic demographic questions. It's very if-then-else oriented or conditional logic based, so you can ask different questions of the patients to get a better sense of who they are and why they may be requesting a consult or to a service from a provider. But it also includes all the necessary tools that you would often see in a patient registration process, such as asking or collecting insurance eligibility information and doing those 270, 271 eligibility checks, which is an API-oriented integration that we have in the intake module. It also, as you saw, has merchant services or payment gateways built in. So if you are collecting copays or other payments, you can collect those through the intake module. It also can ask all your questionnaires or any other data that you feel is necessary for a given use case type, wherein a provider will need some of that information to provide a good consult. So ultimately, it's configurable so that it matches the use case that you're trying to open up to your patients. And while it's called direct-to-consumer, it is built and designed around the notion of a patient being unknown to your system and coming through on demand. But it's also built to process those patients that are known patients to your systems and maybe where you don't need to ask all those questions, and you just need to set them up and put them into the queue of patients.
Thanks so much, Rich. Okay, let's take our third and final poll. How many of you are currently using telemedicine to support any of these use cases, like direct-to-consumer, reaching straight out to track those new patients, direct-to-patient follow-up directly with patients in their homes, employer site programs perhaps, where you're reaching out and providing care to local businesses, or again, behavioral health services that might be direct into like group consults or other types of programs. Okay, thanks so much. So now Rich is going to tell us a little bit more about our embedded solution, and the power of Solo is really its flexibility and interoperability. So Rich is going to tell us more about how Solo can morph into an embedded solution that facilitates workflows driven by third-party systems, but still provides the security, quality, and reliability that we're known for.
Thank you, Andre. So to give you a little bit of background, I've covered it a little bit here. A couple things from a technology standpoint that is enabling better interoperability are more embedded experiences. One, as we've mentioned, we're trying to go to more web-based technology. That opens up a lot of possibilities and allows us to be a lot more oriented towards an API-first strategy. So we're enabled to do a lot more of an embedded experience whereby a provider can actually use single sign-in. They can launch our application from other applications such as Epic or Cerner or other EHRs or other systems. As we've talked about, we can use APIs and or HL7 for scheduling integration so that you can remove the need for double documentation. Wherein a scheduler schedules in one system and has to do it in the other system, we can automate that process. As I've also mentioned, being API first, being web first, we can also do more eligibility checks or merchant services or do integrations around e-prescribing or other types of solutions that you would ultimately need to be able to provide that care to a patient remotely. To give you kind of a different view of it, the other thing that is adding to the capabilities of interoperability is that we've taken different tech stacks and merged them together. What that allows us to do is not only orient our system, our new Solo system around a single stack, but we're also orienting the Solo platform around the FHIR standards and trying to orient our platform around a more consistent and standardized data model. What that allows us to do is, again, taking an API-first approach, is use more and more APIs for things within EHRs, but also other third-party applications, such as Vivify for your remote patient monitoring needs, or GE for a more of an intensive care type use case, or Dr. First for e-prescribing. That all being said, the Solo platform is still being architected and has still built around the necessary or the needed HL7 types of integrations. So if you use Smart Notes, or you're using Intake and you're capturing consent forms, you're creating PDF documents of consult notes, we can still move that data back to all the respective data systems or EHRs or other systems that you might be using in your healthcare system to store all that data and aggregate it for patient care. One thing that we are very excited to begin to do and announce is our Connect Embedded capabilities. And again, going back to our web-based technologies, and specifically a WebRTC audio-video capabilities, is our Connect Embedded product. What our Connect Embedded product will be is from a patient portal, such as MyChart in Epic, or from Hyperspace on the provider side of the interaction, the ability to launch a WebRTC session and connect with your patient without the patient needing to open up different applications or other web browsers, or on the provider side needing to open up a second application, put in a second set of username, password, credentials, but trying to create a more seamless experience where a provider is in their home Hyperspace interface or the patient is in MyChart, and being able to connect with each other in a seamless way and in a way that they don't have to do lots of extra necessary steps. So again, trying to take advantage of that web technology, that WebRTC technology, and create a more efficient and seamless experience to both patient and provider. So as we've kind of talked through this, you've kind of seen many modules. We've talked about the Solo platform being built on a more unified and integrated tech stack, getting to more web-based technologies, still retaining mobile technologies, but ultimately what that ultimately culminates in is the ability to aggregate data in a more consistent and easier way, and that empowers our analytics module. So going back to kind of all the modules we've discussed, by having your provider dashboard with your Smart Notes module, with your integrated imaging module, with your integrated coordinator module, and your integrated intake module, what that better allows us to do is match a audio-video session to a patient ID, to a appointment ID, so that when you're looking at your analytics, you're better able to run data and see how many different types of patient types and visits there were, and ultimately be able to match our data set that is generated on the InTouch side with your data sets that you are building out of your EMRs and other data systems, so that there's some key value pairs when we export our data or you analyze it through analytics. You're better able to see a whole picture of what took place with the patient, even though it was virtual and remote.
Well, Rich, thanks so much. We want to just, before we move into questions and answer session, we're just going to review some of the key takeaways. As a reminder, Solo is being officially launched and unveiled at our Telehealth Innovation Forum in July 15th through the 17th. If you aren't registered, you should take a look, find a time to come out to beautiful Santa Barbara, California. Solo is a single integrated experience for our customers. It really merges together all of the things you saw today and brings a single experience for the providers and the patients. And it virtualizes care across the continuum, from consumer to specialty and emergent use cases. And really, interoperability is at its core. Rich highlighted a lot of those key components, our API approach, and all of that wraps together with analytics to drive success and measure results throughout the platform. And so now we're going to move into a question and answer session. Some of you have submitted questions throughout the session. If you have any questions for us now, we'll take a host of questions. If some questions require deep or long responses, we may opt to answer those offline. We'll ensure we'll get to all of your questions in some format.
Let me maybe take a brief second to go back and talk about integration, because I can see there's a lot of questions around integration and how it works. So first and foremost, the Solo platform is a cloud-based platform. What that allows us to do is sit outside of a single healthcare system and function as a bridge between different healthcare systems or different IT departments or different LANs and WANs or different systems. What that allows us to do is pull data from one system and move it to another system, either through APIs or HL7 integration. We've done many different types of HL7 integrations for things like order messages or different types of HL7 message types that move some of those Smart Notes documents back into the EMR. We've done scheduling integrations. We've done many different types of integrations, but ultimately we do integrate. And technically, I would say we don't integrate directly with the EMR. We integrate with the interface engine or the interface department, whatever they may be using on the healthcare system side to do the integration. So it is still a 50-50 equation in that we will push and pull data, but there is a interface team on the healthcare system side that we would work with to move that data to where it is most appropriate in the system, whether that's the EMR or whether that's some other type of data warehouse. I should also add, under the umbrella of analytics, one service that we offer is a data sharing service. So if you need to get all your data in, say, a CSV format or some other type of format, we can also send that across, drop it on like a secure FTP server for you to consume and add to your patient data. So ultimately, at the end of the day, there's lots of different ways that we integrate with systems, but the advantage that we do have is that we sit out in the cloud and we can sit between all these systems. So if you're providing services, say, to a kind of old-fashioned hub and spoke network, we can do the integrations with all your partner sites and move data from them to you or vice versa. Let's see what else we have here.
So there was a question here, Rich, that asked, there's a lot of questions trying to filter through. There was a question asking, do you have to be using the InTouch devices at the hospital partners to use Solo? So for those of you who we didn't necessarily address directly, we sell a whole host of devices. We also have software that can be, and cart compatibility programs where we can convert existing devices into InTouch compatible devices. So the answer to that question is no, you don't have to have all InTouch devices in order to connect through the InTouch operating system.
So there's one here sitting at the top that asks about the embedded, Connect Embedded product. So one thing that to clarify is that the modules of the Solo platform are not necessarily needed. So in a use case where a provider, all your providers have access to, say, your Epic system, they would be able to document directly into Epic, launch the InTouch audio video, and maybe for that specific use case would not necessarily use Smart Notes. The reason we've built our platform to be configurable and modular is so that you can pick and choose the tools you need for a given use case and kind of mold a solution to your remote providers wherever they may be. But that doesn't necessarily mean that you must have all the modules for any given use case.
There's another question here that asks if we integrate with on-call pager applications where you don't need to duplicate an on-call schedule in two systems. So we've started doing that with customers already. Some of those might continue to require a statement of work depending on the particular systems that are involved, but we absolutely have the capabilities to do that, and that's one of the API-driven approaches that Solo brings to us. Maybe, Rich, you can talk a little bit about patient data being pushed back and forth between EMRs through HL7 feeds. There's a couple of questions on here asking as far as how does patient data make it into the system, from the EMR, to get into Smart Notes or to get from Smart Notes back to the system. I think we can cover a few of these questions just by maybe describing them.
Sure. So for maybe the more tech-oriented participants in the audience, we can do all your standard HL7 messages. So if you want to do discrete data elements wherein anything you capture as discrete data in the InTouch system as your source system, we can push that to your preferred destination as discrete data elements using kind of all your standard, OBX segments and whatnot. But if you prefer, you can also push a base64 encoded PDF note that is generated in our system over to your EMR as well. And very commonly what is that message type, an MDM type message type, for example, would be used for is to move like consent forms that are captured during a consult back to your EMR. That at the core of the Solo platform is an interface engine. We currently use the InterSystems HealthShare interface engine. So if you're familiar with it, kind of a standard interface engine, and it has all the capabilities to move that data. So generally speaking, we will go through the process to build a VPN tunnel between us and the healthcare system, and then we will determine what the message type is and move the data in the preferred type, depending on what the data is, depending on what the format is. But all your standard formats are available. Generally we are doing HL7V 2.8 or somewhere in the 2.x range, but generally we can move the data based off your requirements. That being said, we also have a whole set of APIs and web services. So if there is a possibility for a given system to use APIs, we choose to do so. An example of that actually is we've done an integration with Athena Health. Because they are a cloud-based EHR and also have lots of APIs and web service capabilities, we've done a full integration with Athena Health through APIs without the need for HL7. So we have different tool sets in our arsenal depending on what you need and how you want to move that data.
Thanks so much, Rich. And so, for those of you that are asking questions around these areas, we'll still try to address some of them specifically, but there's just too many to go in and provide very detailed answers on the webinar. So if you don't feel like you got your question answered, please don't. We'll still follow up with you. Here's a question asking, how is the Solo product getting pushed to customers? Solo is not getting pushed, right, in the sense that we have products and services that current customers are already using. We're not forcing some new product on anybody. It'll be available for customers starting in July, and we'll have terms and conditions around how that's procured from our by our customers. Other than that, we will have more details around pricing models and how you acquire the software, how it's implemented. As we get closer to that release date, your account executives and salespeople will be your conduit to understanding what that looks like for you. So there's a question asking, does this platform allow multiple providers to join in during the telehealth visit? The answer is yes. You can multiple providers can you can have multiple providers, you can have multiple patients, you can have both sides.
And maybe to extend that a little bit further, you can have multiple providers that can connect to a device. So if you have, say, a care team that is trying to treat a patient where a device is at the patient bedside, you can do it that way. If everybody is a provider trying to connect to a patient at home, you also have the capability for a multi-provider to single patient capability within the system. Or the inverse of that, we also have the ability for group consults. So if you're doing things like lactation classes or smoking cessation classes and you want to have a group of patients to a single provider, you can also do that as well. Let's see what else we have here. There's a lot of questions coming in.
Yep. So there was a question wanting to learn more about the compatibility program that we offer. We'll definitely provide more details on that, and our account executives can provide you more details as well. There's a question about secure texting available to patients, which is not through a patient portal.
Sure. So maybe to broadly cover kind of secure messaging, the one thing that InTouch has in their product development roadmap is to develop out, as I've mentioned, a core set of APIs that really allows us to integrate or be interoperable with different third-party systems. As you probably are all very well aware, every system has all their own sets of tools. So on our roadmap is the ability to integrate with secure messaging services. So later this year, for example, we will have the capability to integrate with Tiger Text as an example for secure messaging. If there is an asynchronous patient triage-like application that you're referring to, again, if you saw in those videos, there was this concept of a queue in a virtual waiting room. What we intend to do is create APIs where you could utilize other asynchronous triaging-like tools and based off logic built into that application, put the patient into the right queue or the right virtual waiting room. It's probably impossible to answer every single third-party app out there because I'm seeing a list of about 30 different applications.
Lots of questions about third-party apps.
But if you do have questions, we do have a solution design team that works with our sales team out there that can handle a lot of those questions, better understand what the third-party system is that you're utilizing, what the integration capabilities are of that system, and determine whether we can do it or whether it's on our roadmap.
And Rich, I think it's fair to say we don't want to just sit here and say yes to everything. We want to say we need to understand what the scope looks like, what some of the requirements are, and better ascertain. Okay, great. So there's a question here asking, does Solo have an option to not interface into our EMR system, but still can use all the other tools? So yes, absolutely. You can use it actually as a patient database that would capture that information and still have a patient-centric approach. You can still do your intake into the system. It's actually designed to be completely independent, right, Rich?
Correct, yeah. There is one here, also something we did not cover, so I'll cover it here about white labeling. Part of the application can indeed be white labeled. So for example, the intake module is a great example of that, wherein you probably want your brand on that. And the way the intake module works is it can be a unique URL that is masked or embedded into your public website or public domain. Where a patient can say, I want to see a doctor now, and the whole intake module would be branded with your branding. Parts of the other application are not capable of being white labeled, and those are things, for example, like our imaging viewer, which is a DICOM compatible FDA Class 2 application. And so we're limited in what we can white label there. But generally, there is white labeling available for various components of the product.
And so Rich, I think there was a question that came in earlier. I want to make sure we clarify this. There was a quick question around access to the portal. Assuming that the providers are using the Solo portal as their primary source, what if the providers prefer to work directly in the EMR? And so that's exactly what we were talking about with our single sign-on capabilities and Connect Embedded, being able to use the EMR as the workflow and then launch the video visit from the EMR. So we want to make sure that they understand they're confined to the to the patient population of that EMR, right? But and the access locations of that EMR, but they can still do that.
Correct, and maybe, again, in case there are some more technical folks on the call, InTouch, our identity provider, supports our standard OpenID Connect OAuth 2 and SAML protocols, so you can do single sign-on or federated authentication in that manner. The other thing we do support specifically with like Epic is context-aware linking. So when that provider clicks whatever you have labeled the button within the workflow, for example, launch audio video, it would pass in some context so that the session ID, the appointment ID, visit ID, encounter ID, and patient ID, again, could all be tied together in the data that you receive both from InTouch and are capturing in your EMR.
Okay, and so there was another question asking, a couple of questions kind of similar, saying, what if a provider is covering multiple sites, some that use InTouch and some that don't? So there's, just to circle back, right, if you're in our interface, we have many different ways for you to be able to put devices in locations that we can connect to, right? So using either existing InTouch devices or retrofitting other technology that you might have. There's too many permutations and combinations to describe in this one session, but we do have many ways to address what technology you might have and what might be good options for you. So we'd be happy to talk to you about your specific situations and determine, what the best solution might be for you now and in the future.
Maybe I'll also cover peripherals. I see instead of answering specific ones, there's a lot of questions on peripherals here. So first and foremost, there's two types of peripherals in the way that we look at. There are the kind of AVC or audio-video based peripherals such as stethoscopes, otoscopes, derm cams, etc. We have what we call our peripherals program, where we have a set of peripheral devices that we have tested and working in parts of our application, and we are extending some of that capability into the web-based technologies later this year. If that's one category, the second category is kind of your peripherals that are capturing patient information. Through that, we have partnerships where we can capture that information and, for example, capture it in smart notes as maybe a use case. It ultimately comes down to the very specific device that you're trying to integrate, and again, going through that solution design team that we have, they could better help understand on a device-by-device means which ones we can work with and which ones we can't at the moment.
Mm-hmm. And so a really good question came in asking, does Solo have the flexibility to leverage it for in-home patient visits? So and the question continues on saying, not via the InTouch devices on both ends, like using guest links or web portals for patients for ad hoc virtual visits. And the question is absolutely. Mm-hmm. This is really a great example of extending the capabilities, seeing patients in facilities through devices when it makes sense, or being able to send them a link, invite them through, using their own consumer endpoint, right? You always have to use some kind of device, whether it's a tablet or a phone or a laptop in their home, but now we extend those capabilities out.
And maybe I'll pick up on that again and kind of go back to kind of the broader product development strategy of InTouch Health, which is to the extent possible, given where Apple, Microsoft, Google, and other big companies that produce web browsers or operating systems, our goal is to enable, to the best of our ability, device ubiquity for where the patient is and where the provider is. So as I mentioned, we will continue to support our thick client applications on the provider side. We're very oriented towards web-based technologies and trying to stay current with all the mobile technologies on the provider side. On the flip side of that, on the patient side, we are trying to develop a more ubiquitous tool set based off current browsers and browser support and where all the different companies are going. And a good example of that is we were limited on MacBooks, for example, and also limited in some of our iOS technologies due to the way that Apple supported WebRTC. They just recently made an upgrade that we now have the capability to run WebRTC in the Safari browser. And so again, as soon as that becomes available to InTouch, our development teams are working hard to test all that, make sure the experience is good, make sure the technology works. And as that gets rolled out, by Apple every year, we will continue to try to fold that into our Solo platform.
So I think you kind of hit on this, Rich, but there's a question here. You talked a little bit about, there's a few questions about peripherals and such. There's a question here about biometric devices,
right?
Special use case. Did you already cover that?
Biometrics is kind of that second category I talked about, wherein you're capturing discrete data elements that need the patient ID to be consumed by the InTouch Solo platform. So we are working on that. There are, as you can imagine, out in the world of wearable devices and whatnot, thousands and thousands of devices that we won't be able to handle all of them. So it will come down to, again, our solution design team will look at what you have. They will know what our platform is currently capable of, and we can figure out whether or not that specific device you may be interested can be integrated. Another one I see here about USB, yes, all the AVC-based or audio-video-based devices are USB supported. Most of those are your basic USB devices. You plug them in and they will work, but we also, as I mentioned, do have a peripherals program. Again, there are a lot of peripheral devices out in the world, so we kind of going back to the reputable quality of InTouch's platform. We don't just say plug it in and use it. We go through a testing process and make sure the quality of the device is good and that our software effectively works with it.
And so there's a question here that I wanted to address. I think it was asked in a couple of different ways, but as far as the product availability, deliverability, asking sort of, when is the product going to be ready? When can we get it? And Rich hit on a couple of these points that I think we really want to reinforce is that the product's going to be available for sale after the forum, but especially for existing customers that are thinking about the product holistically for their programs, we want to sit down with you and make sure that we're meeting that it's meeting the expectations of what you need to do now, what you need to do in the future, how we might migrate some of your existing systems over, that you use with InTouch over to the new platform. And so, when we think about when is the availability date, delivery date, implementation dates, that'll be a project plan that will work with you. Rich had mentioned our solution design team and our solution delivery teams. They will be working with you very closely along with our account executives to understand what you have now, where you want to go, and what's going to be the right options for you. So I hope that doesn't sound like skirting any questions for some of the questions that might come in, but no, we definitely want to continue to have those conversations with you.
And maybe to build off of that, I do see some questions about existing customers that already have different components of InTouch technology. So as Andre mentioned, there is a process that we'll go through to get you onto Solo, but so that we are making or developing Solo in such a way that, for example, if you have existing devices with InTouch and we develop this new web-based provider interface, you'll be able to make a connection to those devices. So all of your existing investment into InTouch technology is not going to waste. There's just lots of enhancements and a conversion process to make it all work together that we would work with you on.
That's right. And so we're running out of time. For those of you that didn't get your questions answered, we'll definitely follow up with them through email or other venues. And so, Scott, why don't you go ahead and wrap up and provide them with some follow-up information.
Great, yeah. I'd like to give a big thanks to our presenters today. So again, for additional questions or information, you can feel free to contact us at that email address on the screen right now, feedback@intouchhealth.com, or contact us directly using the email addresses provided in the bios. I'd also encourage you to please visit our website's resources page for additional information or for additional webinars that you can check out at that URL on the screen as well. And thank you, everybody, for joining. You have a good rest of your day.